LiliF Diagnostics, developed to screen for a quantitative range of COVID-19 IgG. Is your IgG getting closer to normal life? Go back to normal life. Why COVID-19 IgG? COVID-19 IgM occurs in the early stage and disappears. However, COVID-19 IgG remains in blood and provides long-term immunity. The LiliF GBN COVID-19 IgG Rapid Kit was developed to screen for a quantitative range of COVID-19 IgG in the blood. If both T1 and T2 appear red, there is a large amount of COVID-19 IgG in the blood, so the stage of infection can be estimated roughly. Test kit components. LiliF GBN COVID-19 IgG Rapid Kit. COVID-19 IgG Test Device. Bottle of sample diluent buffer. Mini tip tube. Instruction for use. Specimens and methods. Check each individual component in the GBN COVID-19 IgG Rapid Kit. Also, please check the shelf life and storage temperature of the product. Use whole blood, serum, or plasma as specimen. Collect 10 microliters of samples. Load the collected sample to the pad of the device hole. Add 3 drops, 100 microliters of sample diluent buffer. Wait for 10 to 15 minutes until the red line appears on the control line. Check the result. Interpretation of test result. Positive. Red line must appear on both C and T1 lines in the detection window. In addition, when the T1 line and the T2 line are seen together, it is a strong positive. Negative. Red line only appears on the control line in the detection window, and no red line should appear on the test line, T1 and T2. Invalid. If red line does not appear on the C line, this result is interpreted as invalid and test again. Or, if the T1 line is not confirmed and only T2 is shown alone, retesting is required. Easier. No special equipment needed. Intuitive visual interpretation. Accurate. Super sensitivity with specialized developing antigen. Simple and rapid. Just 10 microliters of specimen. Result in 10 to 15 minutes. Global Patent Application Kit, KFDA export licensed, and CE/IVD certified product. Go back to normal life.